Question 1. Compliance review shows that a senior physician consistently utilizes a treatment protocol for a common condition that differs from the most recently published peer-reviewed evidence-based practice guidelines adopted by the organization. The physician states their method has yielded excellent results for many years and expresses reluctance to change. As a certified medical manager, CMM, what is the most appropriate course of action to ensure regulatory compliance and optimal patient care? Option A. Modify the EBP guidelines to incorporate elements of the physician's preferred protocol, creating a hybrid approach that attempts to satisfy both the physician and the EBP, even if the hybrid approach lacks specific evidence to support its efficacy. Option B. Initiate a formal review process to compare the physician's protocol with the EBP guidelines, seeking to understand the rationale for the physician's approach and collaboratively determine the safest and most effective course of action, prioritizing adherence to current EBP unless a compelling, evidence-based justification for deviation exists. Option C. Allow the physician to continue using their established protocol, as their long-standing success suggests it is effective, and address the EBP guideline discrepancy at a later, less urgent time. Option D. Implement the EBP guidelines strictly as written, requiring the physician to immediately cease using their preferred protocol without further discussion or consideration of their experience. Correct answer is B. Initiate a formal review process to compare the physician's protocol with the EBP guidelines, seeking to understand the rationale for the physician's approach and collaboratively determine the safest and most effective course of action, prioritizing adherence to current EBP unless a compelling, evidence-based justification for deviation exists. Explanation. Scenario analysis. This scenario presents a common challenge in medical management where established evidence-based practice, guidelines conflict with a physician's long-standing personal experience and preference. The professional challenge lies in balancing the imperative to adhere to current best practices, which are designed to optimize patient outcomes and ensure consistent quality of care, with the need to respect physician autonomy and acknowledge the value of clinical experience. Navigating this requires a nuanced approach that prioritizes patient safety and regulatory compliance without alienating experienced practitioners. Correct approach analysis. Adhering to the most current, peer-reviewed evidence-based practice guidelines, as recommended by the relevant professional medical bodies and regulatory agencies, represents best professional practice. This approach is mandated by the Certified Medical Manager (CMM) framework, which emphasizes the integration of EBP into clinical decision-making and organizational policy. Regulatory compliance is achieved by demonstrating that patient care protocols are aligned with established standards of care, thereby minimizing legal and ethical risks. Ethically, it upholds the principle of beneficence by ensuring patients receive care supported by the strongest available evidence. Incorrect approaches analysis. Implementing a protocol based solely on the physician's personal experience without critically evaluating its alignment with current EBP represents a significant regulatory and ethical failure. This approach risks providing suboptimal care, potentially leading to adverse patient outcomes and increased liability for the organization. It fails to meet the CMM's requirement for evidence-informed practice and could be seen as a deviation from accepted standards of care, making it difficult to defend in a regulatory review. Adopting a compromise that dilutes the core principles of the EBP guideline to accommodate the physician's preference, without a clear, evidence-based rationale for the modification, is also professionally unacceptable. This approach undermines the integrity of EBP and can lead to inconsistent care. It suggests a failure to prioritize patient well-being based on robust evidence and may not satisfy regulatory expectations for adherence to established guidelines. Ignoring the discrepancy and allowing both the physician's preferred method and the EBP guideline to coexist without clear direction or resolution creates an environment of ambiguity. This can lead to variations in care, confusion among staff, and a lack of accountability. From a regulatory standpoint, it demonstrates a failure in effective management and oversight, potentially exposing the organization to risks associated with inconsistent application of best practices. Professional reasoning. Professionals should approach such discrepancies by initiating a structured dialogue. This involves presenting the physician with the EBP guideline, highlighting the evidence supporting its recommendations, and discussing any potential concerns they may have. If the physician's experience suggests a valid reason to deviate or adapt the guideline, this should be explored through a formal process of evidence review, and if necessary, consultation with clinical experts or relevant committees. The ultimate decision should be based on a thorough assessment of patient safety, clinical efficacy, and adherence to regulatory requirements, with clear documentation of the rationale for any deviations. The goal is to foster a culture of continuous improvement where EBP is embraced and integrated, while respecting the valuable insights of experienced clinicians. Question 2. Compliance review shows that a medical practice is experiencing significant operational inefficiencies and patient wait times. The Certified Medical Manager, CMM, is considering implementing changes to improve these metrics. Which of the following approaches best aligns with the CMM's responsibilities within the established regulatory framework for healthcare management? Option A. Researching and adopting operational models and patient management strategies that have proven successful in healthcare systems with different funding structures and regulatory oversight, with the goal of replicating their efficiency. Option B. Prioritizing the implementation of cost-saving measures across all departments, even if it means reducing staffing levels or limiting access to certain diagnostic services to immediately improve financial performance. Option C. Advocating for a complete overhaul of the existing healthcare system to a model perceived as more efficient, without first understanding the local regulatory implications or the feasibility of such a transition. Option D. Conducting a thorough analysis of the current healthcare system structure, funding mechanisms, and regulatory requirements to identify areas for optimization that are compliant with local laws and ethical standards. The correct answer is A. Researching and adopting operational models and patient management strategies that have proven successful in healthcare systems with different funding structures and regulatory oversight, with the goal of replicating their efficiency. Explanation. This scenario presents a professional challenge due to the inherent complexity of navigating different healthcare system models and their impact on patient care delivery and resource allocation within a specific regulatory environment. The Certified Medical Manager, CMM, must exercise careful judgment to ensure compliance and ethical practice. The correct approach represents best professional practice because it prioritizes a comprehensive understanding of the prevailing healthcare system structure, funding mechanisms, and regulatory oversight. This allows for informed decision-making that aligns with established legal frameworks and ethical guidelines for patient management and operational efficiency. Specifically, it acknowledges that the CMM's role is to optimize within the existing system, not to advocate for a wholesale change without proper authorization or understanding of the implications. This aligns with the CMM's responsibility to manage within the defined parameters of their practice and jurisdiction. An incorrect approach that focuses solely on adopting practices from a different healthcare system without considering the local regulatory framework is professionally unacceptable. This failure stems from a lack of jurisdictional awareness, potentially leading to noncompliance with local laws, ethical breaches related to patient access or data privacy, and operational inefficiencies. For instance, implementing a fee-for-service model in a predominantly publicly funded system could violate regulations regarding patient billing and access to care, creating an inequitable system. Another incorrect approach that involves prioritizing cost reduction above all else, without a thorough analysis of the impact on quality of care or patient outcomes, is also professionally unsound. This can lead to ethical violations by compromising patient well-being and potentially contravening regulations that mandate a certain standard of care. Such a focus can also lead to regulatory scrutiny if it results in substandard care or unmet patient needs, which are often governed by specific quality assurance mandates. The professional reasoning process for similar situations should involve a systematic evaluation of the current healthcare system's characteristics, including its funding, delivery models, and regulatory landscape. The CMM should then assess proposed changes or operational strategies against these established parameters, considering their impact on patient care, ethical obligations, and legal compliance. This involves seeking clarification from regulatory bodies when necessary and engaging in continuous professional development to stay abreast of evolving healthcare policies and best practices within the specific jurisdiction. Question 3. Assessment of the most effective strategy for a medical practice experiencing increasing patient wait times and appointment backlogs, considering the need to maintain high-quality care and operational efficiency within the Certified Medical Manager (CMM) framework. Option A. Conduct a comprehensive audit of current patient flow, identifying specific bottlenecks in scheduling, registration, and clinical throughput, and implement data-driven process improvements and staff retraining. Option B. Implement a strict appointment cancellation policy with significant penalties to discourage no-shows and free up slots, without analyzing the underlying reasons for cancellations. Option C. Immediately hire additional clinical staff across all departments to increase overall capacity and reduce the perceived burden on existing personnel. Option D. Prioritize all new patient appointments over existing patient follow-up appointments to reduce the backlog of new patient inquiries. The correct answer is A. Conduct a comprehensive audit of current patient flow, identifying specific bottlenecks in scheduling, registration, and clinical throughput, and implement data-driven process improvements and staff retraining. Explanation: this scenario presents a common challenge in medical management, balancing patient access and timely care with resource limitations. The core difficulty lies in optimizing patient flow to prevent bottlenecks and delays without compromising the quality of care or overburdening staff. A manager must consider not only the immediate needs of patients, but also the long-term implications for operational efficiency and regulatory compliance. The correct approach involves a systematic analysis of current patient flow, identifying specific points of congestion, and implementing targeted interventions. This might include reevaluating scheduling protocols, optimizing staff allocation based on peak demand, or exploring technology solutions to streamline administrative processes. Such an approach aligns with the Certified Medical Manager (CMM) principles of efficient resource utilization and patient-centered care, ensuring adherence to any relevant healthcare regulations regarding patient wait times and access to services. It demonstrates a proactive and data-driven strategy to improve operational performance. An incorrect approach would be to implement broad, unanalyzed changes, such as simply increasing staffing, without understanding the root cause of delays. This could lead to inefficient resource allocation and may not address the actual bottlenecks. Another incorrect approach would be to prioritize certain patient groups for faster access, without a clear, ethically justifiable, and regulatory compliant triage system, potentially leading to accusations of unfairness or discrimination. Ignoring patient feedback or staff concerns about workflow issues is also a failure, as it neglects crucial qualitative data that can inform effective solutions and maintain a positive working environment. These approaches fail to demonstrate due diligence, potentially violate ethical standards of equitable care, and could lead to noncompliance with healthcare operational guidelines. Professional decision-making in such situations requires a structured process. First, clearly define the problem by gathering data on patient wait times, throughput, and resource utilization. Second, identify potential solutions, considering both immediate fixes and long-term improvements. Third, evaluate these solutions based on their feasibility, cost-effectiveness, impact on patient care, and regulatory compliance. Finally, implement the chosen solution, monitor its effectiveness, and be prepared to make adjustments. This iterative process ensures that management decisions are informed, ethical, and effective in improving patient flow and capacity management. Question 4. Comparative studies suggest that medical facilities often face significant challenges when negotiating new collective bargaining agreements with their nursing staff unions. Considering the Certified Medical Manager (CMM) role within a U.S.-regulated healthcare environment, which of the following approaches best navigates the complexities of labor relations and union negotiations while adhering to regulatory frameworks and ethical best practices? Option A. Offering significant concessions on all union demands without thorough analysis, prioritizing immediate contract finalization to avoid prolonged disputes. Option B. Presenting a comprehensive proposal supported by detailed financial data and industry benchmarks, while actively seeking employee input and demonstrating a willingness to negotiate on key issues to find mutually agreeable solutions. Option C. Focusing negotiations solely on the organization's financial constraints, downplaying the impact of proposed changes on employee benefits and working conditions. Option D. Implementing proposed changes unilaterally after a brief notification period to the union, citing the need for immediate operational efficiency improvements. The correct answer is B. Presenting a comprehensive proposal supported by detailed financial data and industry benchmarks, while actively seeking employee input and demonstrating a willingness to negotiate on key issues to find mutually agreeable solutions. Explanation. This scenario presents a common implementation challenge in labor relations, balancing the need for operational efficiency with the rights and expectations of unionized employees during contract negotiations. The challenge lies in navigating the complex legal framework governing collective bargaining, ensuring compliance with all applicable regulations, and fostering a constructive relationship with the union to achieve a mutually agreeable outcome. The Certified Medical Manager, CMM, must demonstrate a nuanced understanding of labor law, negotiation strategies, and ethical considerations to effectively manage this process. The correct approach emphasizes proactive communication, data-driven proposals, and a genuine commitment to collaborative problem-solving. This aligns with best professional practices by respecting the collective bargaining process as mandated by labor laws, which aim to promote fair and equitable working conditions. By engaging in open dialogue, presenting well-researched proposals, and actively seeking common ground, the CMM demonstrates a commitment to a fair negotiation, which is ethically sound and legally compliant. This approach fosters trust and can lead to more sustainable and productive labor management relations. An incorrect approach that focuses solely on unilateral decision-making without meaningful engagement with the union would be a significant regulatory and ethical failure. Such an approach would likely violate the duty to bargain in good faith, a cornerstone of labor law. Ethically, it undermines the principles of fairness and respect for employee representation. Another incorrect approach that involves making concessions without proper analysis or understanding of the long-term financial implications for the organization could lead to unsustainable operational costs, potentially jeopardizing patient care and organizational stability. This demonstrates a failure in due diligence and responsible management. A third incorrect approach that involves misrepresenting information or engaging in deceptive tactics during negotiations is not only unethical, but also a direct violation of labor laws that require honesty and transparency in bargaining. This erodes trust and can lead to legal repercussions. The professional decision-making process for similar situations should involve a thorough understanding of the relevant labor laws and collective bargaining agreements. It requires careful preparation, including gathering data on industry standards, organizational financial health, and employee concerns. The CMM should develop clear negotiation objectives and strategies while remaining flexible and open to compromise. Building a strong working relationship with union representatives based on mutual respect and open communication is crucial. Regular consultation with legal counsel specializing in labor law is also advisable to ensure compliance and mitigate risks. Question 5. Operational review demonstrates that a long-term employee who has recently been diagnosed with a chronic condition affecting their mobility has requested significant modifications to their work schedule and physical workspace. The employee has also expressed concerns about the safety of certain equipment in their immediate work area, citing potential risks due to their condition. The manager is under pressure to maintain current productivity levels and is concerned about the cost and disruption associated with extensive modifications. What is the most appropriate immediate course of action for the medical manager? Option A. Immediately consult with legal counsel and the Human Resources Department to understand the specific requirements under FMLA, ADA, and OSHA, and to develop a plan for a formal interactive process with the employee regarding accommodations and safety concerns. Option B. Inform the employee that while their concerns are noted, operational demands necessitate maintaining the current work schedule and workspace, and suggest they explore alternative roles if they cannot perform their duties as is. Option C. Advise the employee to take an extended leave of absence until their condition stabilizes, without formally assessing their eligibility for FMLA or exploring ADA accommodations. Option D. Implement minor, low-cost adjustments to the workspace and schedule without formal consultation, hoping these changes will suffice and avoid further disruption or legal entanglements. The correct answer is A. Immediately consult with legal counsel and the Human Resources Department to understand the specific requirements under FMLA, ADA, and OSHA, and to develop a plan for a formal interactive process with the employee regarding accommodations and safety concerns. Explanation. This scenario presents a common challenge for medical managers, balancing operational efficiency with legal and ethical obligations to employees. The core difficulty lies in interpreting and applying complex employment laws like the Family and Medical Leave Act, FMLA, the Americans with Disabilities Act, ADA, and the Occupational Safety and Health Act, OSHA, in a way that protects both the organization and its staff. A manager must navigate situations where employee needs, potential legal ramifications, and business continuity intersect. This requires a nuanced understanding of each law's provisions, eligibility criteria, and employer responsibilities. The correct approach prioritizes a thorough, documented investigation and consultation with legal counsel before making any decisions regarding employee status or workplace modifications. This demonstrates best professional practice by adhering to due process, ensuring compliance with all applicable federal regulations, and mitigating legal risk. Specifically, it acknowledges the protected rights of employees under FMLA for qualifying medical leave, under ADA for reasonable accommodations, and the employer's duty under OSHA to provide a safe working environment. Seeking expert legal advice is crucial to accurately assess the situation against these legal frameworks, preventing potential discrimination claims, wrongful termination suits, or OSHA violations. An incorrect approach that dismisses the employee's concerns without proper investigation fails to uphold the principles of fairness and legal compliance. This could lead to violations of ADA by failing to engage in the interactive process for accommodation, or FMLA by improperly denying leave. Another incorrect approach that focuses solely on immediate operational needs without considering legal implications risks violating OSHA by potentially creating an unsafe work environment, or ADA, by failing to accommodate a disability. A third incorrect approach that makes assumptions about the employee's condition or ability to perform duties without a formal assessment or legal consultation is ethically unsound and legally perilous, potentially leading to discrimination claims under ADA or FMLA. Professional decision-making in such situations requires a systematic approach. First, gather all relevant facts and documentation. Second, identify the applicable laws and regulations. Third, consult with legal counsel or HR experts to interpret these laws in the context of the specific facts. Fourth, engage in required interactive processes, e.g., ADA accommodation discussions. Fifth, make a decision based on legal requirements and best practices. And finally, document all steps taken and the rationale for the decision. Question 6. To address the challenge of improving patient outcomes and operational efficiency, a medical practice is exploring the adoption of a new healthcare delivery model. Which of the following approaches best ensures compliance with U.S. regulatory frameworks and ethical patient care standards? Option A. Conduct a thorough review of all applicable federal and state healthcare regulations, including HIPAA, Medicare, and state licensing laws, to determine how each potential delivery model aligns with these requirements before selecting and implementing a model. Option B. Select a delivery model based on its popularity and perceived success in other healthcare organizations, without conducting an in-depth analysis of specific regulatory requirements relevant to the practice's patient population and services. Option C. Delegate the entire selection and implementation process of the new delivery model to an external consulting firm, with minimal internal oversight or direct engagement from the practice's management team. Option D. Prioritize the adoption of a delivery model that promises the greatest cost savings, assuming that regulatory compliance will be addressed as a secondary concern during the implementation phase. The correct answer is A. Conduct a thorough review of all applicable federal and state healthcare regulations, including HIPAA, Medicare, and state licensing laws, to determine how each potential delivery model aligns with these requirements before selecting and implementing a model. Explanation. This scenario presents a professional challenge because a medical practice is considering a significant shift in its operational structure without fully understanding the regulatory implications for patient care and data management. The Certified Medical Manager, CMM, designation implies a need for adherence to specific U.S. healthcare regulations, particularly those governing patient privacy, quality of care, and provider responsibilities. Careful judgment is required to ensure any new healthcare delivery model complies with all applicable federal and state laws, as well as ethical standards of patient advocacy and data security. The correct approach represents best professional practice because it prioritizes a comprehensive review of existing regulatory frameworks before implementing changes. This proactive stance ensures that the chosen healthcare delivery model, whether it be a patient-centered medical home, an accountable care organization, or another model, aligns with the Health Insurance Portability and Accountability Act, HIPAA, for patient data privacy, Medicare and Medicaid regulations for reimbursement and quality standards, and state-specific licensing and practice acts. It also ensures that the model supports the core mission of providing high-quality, accessible, and efficient patient care while maintaining financial viability and operational integrity. An incorrect approach that focuses solely on cost reduction without considering regulatory compliance would fail to uphold the legal and ethical obligations to protect patient information and ensure the quality of care. This could lead to significant fines, legal action, and damage to the practice's reputation. Another incorrect approach that adopts a new model based on anecdotal evidence or industry trends without a thorough regulatory assessment risks noncompliance with critical patient safety and data security mandates. This demonstrates a lack of due diligence and a disregard for the legal framework governing healthcare operations. Finally, an approach that delegates the entire decision-making process to external consultants without internal oversight or a clear understanding of the practice's specific regulatory environment could result in a model that is technically sound but not practically or legally implementable within the practice's context. Professional reasoning in such situations requires a systematic approach. First, identify the core objectives of the proposed change. Second, thoroughly research all relevant federal and state regulations pertaining to the chosen healthcare delivery model. Third, assess the practice's current infrastructure and resources against the requirements of the new model and its regulatory obligations. Fourth, consult with legal counsel and compliance officers to validate the chosen path. And finally, develop a phased implementation plan that includes ongoing monitoring and adaptation to ensure sustained compliance and optimal patient outcomes. Question 7. Cost-benefit analysis shows that implementing a new patient feedback system and a comprehensive staff training program on evidence-based protocols would significantly improve patient satisfaction scores and reduce adverse event rates, but it requires a substantial upfront investment in technology and dedicated staff time for training. Which of the following approaches best addresses this implementation challenge while adhering to quality assurance principles? Option A. Prioritize the implementation of the new patient feedback system to gather objective data on patient experience and concurrently develop a phased training plan for staff on the most critical evidence-based protocols identified through initial data review, seeking incremental budget approvals as progress is demonstrated. Option B. Implement the new patient feedback system immediately and rely on existing staff knowledge and on-the-job learning to adapt to any identified protocol deviations without formal training to conserve resources. Option C. Delay the implementation of both the new patient feedback system and the staff training program until a more favorable budget cycle allows for the full, simultaneous rollout of both initiatives, minimizing immediate financial strain. Option D. Focus exclusively on the staff training program, assuming that improved clinical practice will naturally lead to better patient feedback, and defer the technology investment for the feedback system to a later date. The correct answer is A. Prioritize the implementation of the new patient feedback system to gather objective data on patient experience and concurrently develop a phased training plan for staff on the most critical evidence-based protocols identified through initial data review, seeking incremental budget approvals as progress is demonstrated. Explanation. This scenario presents a common implementation challenge in quality assurance and performance improvement within a medical management context. The core difficulty lies in balancing the imperative for data-driven decision-making with the practical realities of resource allocation and staff engagement. A certified medical manager, CMM, must navigate the tension between identifying areas for improvement and the potential disruption or cost associated with implementing those changes. The professional challenge is to select an approach that is both effective in driving quality outcomes and sustainable within the operational constraints of the medical practice. Careful judgment is required to avoid superficial fixes or overly burdensome initiatives that could undermine morale or patient care. The correct approach represents best professional practice because it prioritizes a systematic, evidence-based method for identifying and addressing performance gaps. It aligns with the core principles of quality assurance by focusing on measurable outcomes and continuous improvement cycles. This approach is ethically sound as it directly aims to enhance patient safety and care quality, fulfilling the manager's fiduciary duty to patients. Regulatory frameworks for medical management, while not explicitly detailed here due to the exam's specific jurisdiction, universally emphasize the importance of robust quality improvement programs that are data-informed and integrated into daily operations. This approach ensures that improvements are targeted, impactful, and sustainable, rather than reactive or based on anecdotal evidence. An incorrect approach that focuses solely on immediate cost reduction, without a thorough understanding of the underlying performance issues, would be ethically problematic. It risks compromising patient care by cutting resources essential for quality delivery, potentially violating patient safety standards and regulatory requirements for adequate staffing and equipment. Another incorrect approach that relies on anecdotal feedback without systematic data collection fails to provide objective evidence of performance issues. This can lead to misallocation of resources, addressing perceived problems rather than actual ones, and can be seen as a failure to uphold professional standards of evidence-based practice. A third incorrect approach that implements changes without staff buy-in or adequate training can lead to resistance, errors, and ultimately, a failure to achieve the desired quality improvements, potentially creating new risks and inefficiencies. Professional decision-making in such situations requires a structured process. First, clearly define the quality objective and the performance metrics associated with it. Second, gather and analyze relevant data to identify specific areas of underperformance. Third, explore potential root causes for these performance gaps. Fourth, evaluate various intervention strategies, considering their potential impact on quality, cost, and staff workflow. Fifth, select the most appropriate intervention based on this comprehensive evaluation, ensuring it is aligned with regulatory requirements and ethical obligations. Finally, implement the chosen strategy with clear communication, adequate training, and a plan for ongoing monitoring and evaluation. Question 8. Risk assessment procedures indicate that the current manual patient record system is inefficient and poses a growing risk of data errors. The medical practice is considering integrating a new technology solution to streamline operations and enhance patient data management. Which of the following approaches to technology integration best aligns with the regulatory framework for medical management, prioritizing data security, patient privacy, and operational efficiency? Option A. The utilization of a free, open-source EHR solution without dedicated IT support and a thorough review of its security architecture and compliance certifications. Option B. The immediate deployment of a fully integrated on-premise EHR system without a prior comprehensive security audit or dedicated staff training program. Option C. A phased implementation of a cloud-based electronic health record (EHR) system with robust data encryption and access controls, allowing for gradual adoption and comprehensive staff training. Option D. The adoption of a proprietary, standalone patient portal that offers advanced engagement features but does not integrate with the core EHR system. The correct answer is C. A phased implementation of a cloud-based electronic health record (EHR) system with robust data encryption and access controls, allowing for gradual adoption and comprehensive staff training. Explanation. Scenario analysis. This scenario presents a common challenge in healthcare management, balancing the adoption of new technologies with existing operational workflows and regulatory compliance. The professional challenge lies in selecting a technology integration strategy that not only enhances efficiency and patient care, but also adheres to the stringent data privacy and security mandates governing medical information. The need for a comparative analysis arises from the existence of multiple viable integration approaches, each with distinct implications for cost, implementation complexity, staff training, and, crucially, regulatory adherence. Careful judgment is required to weigh these factors and choose the path that best mitigates risks while maximizing benefits. Correct approach analysis. The correct approach, focusing on a phased integration of a cloud-based electronic health record (EHR) system with robust data encryption and access controls, represents best professional practice because it directly addresses the core requirements of the Certified Medical Manager (CMM) regulatory framework. This framework, which aligns with U.S. federal regulations such as HIPAA, Health Insurance Portability and Accountability Act, mandates the protection of protected health information. 5. A phased approach allows for thorough testing, staff training, and gradual adaptation, minimizing disruption and ensuring compliance at each stage. Cloud-based solutions, when properly secured with encryption and access controls, can offer scalability and accessibility while meeting HIPAA security rule requirements for safeguarding electronic PHI. This strategy prioritizes patient data security and privacy, a fundamental ethical and legal obligation for medical managers. Incorrect approach is analysis. Implementing a fully integrated, on-premise EHR system without a comprehensive security audit and staff training program is professionally unacceptable. This approach fails to proactively address potential vulnerabilities inherent in any complex system, risking breaches of PHI. It neglects the critical need for ongoing security assessments and staff education, which are implicit requirements for maintaining compliance with data protection laws. Adopting a proprietary, standalone patient portal that does not integrate with the core EHR system, even if it offers advanced patient engagement features, is also professionally unsound. This creates data silos, hindering comprehensive patient care and potentially leading to incomplete or inaccurate medical records. Furthermore, without clear protocols for data sharing and security between the portal and the EHR, it introduces significant compliance risks related to data integrity and unauthorized access. Utilizing a free, open-source EHR solution without dedicated IT support and a thorough review of its security architecture and compliance certifications is a grave regulatory and ethical failure. Such solutions often lack the robust security features, audit trails, and vendor support necessary to meet the rigorous demands of healthcare data protection. This approach demonstrates a disregard for the potential consequences of data breaches and noncompliance, exposing the organization and its patients to significant harm. Professional reasoning. Professionals should approach technology integration by first conducting a thorough needs assessment, identifying operational gaps and opportunities for improvement. This should be followed by a comprehensive risk assessment, specifically evaluating the security and privacy implications of potential solutions against relevant regulatory frameworks, e.g., HIPAA in the U.S. A comparative analysis of different integration strategies, considering factors like cost, scalability, interoperability, and most importantly, compliance, is essential. The decision-making process should prioritize solutions that offer a clear path to regulatory adherence, robust data security, and minimal disruption to patient care. A phased implementation, coupled with continuous staff training and ongoing security monitoring, forms the bedrock of responsible technology adoption in healthcare. Question 9. The monitoring system demonstrates a consistent upward trend in the cost of a specific medical supply used across multiple departments. Which of the following represents the most professionally sound and ethically responsible course of action for a certified medical manager? Option A. Initiate an immediate investigation into the root causes of the cost increase, including supplier negotiations, alternative sourcing, and clinical efficacy of current and potential substitutes, while engaging relevant department heads and clinical staff in the review process. Option B. Mandate an immediate switch to the lowest cost alternative supply available on the market to curb the rising expenses. Option C. Implement across-the-board budget cuts in all departments to offset the unexpected rise in supply costs. Option D. Absorb the increased cost without further investigation, assuming it is a temporary market fluctuation. The correct answer is A. Initiate an immediate investigation into the root causes of the cost increase, including supplier negotiations, alternative sourcing, and clinical efficacy of current and potential substitutes, while engaging relevant department heads and clinical staff in the review process. Explanation. The monitoring system demonstrates a consistent upward trend in the cost of a specific medical supply used across multiple departments. This scenario is professionally challenging because it requires a medical manager to balance the imperative of cost containment with the non-negotiable requirement of maintaining the quality of patient care and ensuring the availability of necessary supplies. A hasty or poorly informed decision could lead to either compromising patient safety by substituting inferior products or creating significant operational disruptions. The correct approach which involves a multifaceted investigation into the cost drivers and a collaborative review with clinical staff and procurement, represents best professional practice. This aligns with the principles of responsible resource management and ethical stewardship of healthcare funds, as mandated by general healthcare management best practices and implied by regulatory frameworks that emphasize efficiency and effectiveness in healthcare delivery. Specifically, it upholds the ethical obligation to provide high-quality care while being fiscally prudent. This approach allows for informed decision-making based on comprehensive data, considering clinical efficacy, supply chain reliability, and potential for bulk purchasing or alternative sourcing, all while ensuring compliance with any relevant procurement regulations that may govern the acquisition of medical supplies. An incorrect approach that immediately mandates a switch to the cheapest available alternative without further investigation fails to consider the critical aspect of product efficacy and patient safety. This could lead to regulatory noncompliance if the cheaper alternative does not meet established clinical standards or if it results in adverse patient outcomes, which would violate patient care standards and potentially trigger reporting requirements. Another incorrect approach, which is to simply absorb the increased cost without investigation, neglects the manager's fiduciary responsibility to control expenses and optimize resource allocation, potentially leading to budget overruns and impacting the financial sustainability of the department or organization. This oversight could be viewed as a failure in operational management and financial oversight, which are key components of managerial responsibility. A third incorrect approach, focusing solely on departmental budget cuts without understanding the root cause of the supply cost increase, is a superficial solution that fails to address the underlying issue and may lead to unintended consequences, such as impacting other essential services or creating staff dissatisfaction due to resource limitations. This demonstrates a lack of analytical depth and a failure to engage in proactive problem-solving. Professional decision-making in such situations requires a systematic process. First, thoroughly analyze the data to identify the scope and potential causes of the cost increase. Second, engage relevant stakeholders, including clinical teams who use the supplies and procurement specialists, to gather diverse perspectives and expertise. Third, evaluate potential solutions based on a balanced consideration of cost, quality, safety, and operational impact. Finally, implement the chosen solution with clear communication and establish ongoing monitoring to ensure effectiveness and prevent recurrence. Question 10. Consider a scenario where a physician recommends a specialized diagnostic imaging procedure for a patient exhibiting complex, nonspecific symptoms. The patient has coverage through a private insurance plan. The medical assistant is responsible for initiating the pre-authorization process. What is the most appropriate course of action for the medical assistant to ensure the procedure is covered and billed correctly, adhering to the principles of third-party payer systems? Option A. Submit the pre-authorization request using a more general diagnostic code that is known to be frequently approved by the insurance company, even if it does not perfectly reflect the specific procedure ordered by the physician. Option B. Proceed with scheduling the diagnostic imaging procedure immediately, as the physician has deemed it medically necessary, and inform the patient that they will be billed for any services not covered by insurance. Option C. Submit the pre-authorization request to the insurance company with the physician's order and a brief description of the patient's symptoms, assuming the insurance company will approve based on the physician's recommendation. Option D. Contact the patient's insurance provider to verify coverage for the specific diagnostic imaging procedure and understand any pre-authorization requirements, including necessary documentation and potential limitations, before submitting the request. The correct answer is C. Submit the pre-authorization request to the insurance company with the physician's order and a brief description of the patient's symptoms, assuming the insurance company will approve based on the physician's recommendation. Explanation. This scenario presents a common challenge in medical management, navigating the complexities of third-party payer systems to ensure appropriate patient care and financial viability. The core difficulty lies in balancing the provider's clinical judgment with the payer's reimbursement policies, which can sometimes create barriers to necessary treatment. A certified medical manager, CMM, must possess a thorough understanding of these systems to advocate effectively for patients and the practice. The correct approach involves a systematic process of verifying coverage, understanding payer-specific requirements, and engaging in proactive communication. This aligns with best professional practice by prioritizing patient well-being and adherence to regulatory frameworks governing insurance claims and medical necessity. It demonstrates a commitment to ethical billing and coding, minimizing the risk of claim denials and subsequent financial repercussions for both the patient and the provider. Incorrect approaches often stem from assumptions, a lack of due diligence, or a failure to follow established protocols. Submitting claims without verifying coverage can lead to significant claim denials, requiring extensive rework and potentially impacting revenue cycles. Ignoring payer-specific pre-authorization requirements can result in non-payment, even if the service is deemed medically necessary by the provider. Misrepresenting services or diagnoses to fit payer criteria is a serious ethical and regulatory violation, potentially leading to audits, penalties, and reputational damage. The professional decision-making process for such situations should involve 1. Information gathering. Obtain all relevant patient information, including insurance details and the proposed treatment plan. 2. Coverage verification. Contact the payer directly or utilize electronic verification tools to confirm coverage for the specific service and diagnosis. 3. Payer policy review. Understand the payer's specific policies regarding pre-authorization, medical necessity documentation, and billing guidelines for the service in question. 4. Clinical documentation. Ensure that the medical record clearly documents the medical necessity of the proposed service, aligning with payer criteria where possible. 5. Communication and advocacy. If there are discrepancies or potential barriers, communicate proactively with the payer and advocate for the patient's needs, providing necessary documentation. 6. Ethical compliance. Always adhere to ethical billing and coding practices, ensuring accurate representation of services rendered. Question 11. The investigation demonstrates that a medical practice is considering a new market segmentation strategy to increase its patient volume. Which of the following approaches best aligns with regulatory compliance and ethical patient engagement for a medical practice? Option A. Identifying the highest income zip codes within the service area and focusing all marketing efforts exclusively on these affluent neighborhoods to maximize revenue potential. Option B. Developing marketing campaigns that highlight the most advanced and expensive treatments, targeting individuals who appear to be less health conscious and more susceptible to persuasive advertising. Option C. Creating patient segments based on perceived health risks and insurance coverage, prioritizing marketing to those with the most comprehensive insurance plans. Option D. Segmenting the market based on observable demographic characteristics and geographic location to tailor service offerings and outreach, ensuring all marketing materials are clear, accurate, and accessible to diverse patient groups. The correct answer is D. Segmenting the market based on observable demographic characteristics and geographic location to tailor service offerings and outreach, ensuring all marketing materials are clear, accurate, and accessible to diverse patient groups. Explanation. This scenario presents a professional challenge because a medical practice, aiming to expand its patient base, must navigate the complexities of market analysis and segmentation, while strictly adhering to the regulatory framework governing medical practices. The core difficulty lies in ensuring that any segmentation strategy is not only effective for business growth, but also ethically sound and legally compliant, avoiding any practices that could be construed as discriminatory or exploitative. Careful judgment is required to balance commercial objectives with patient welfare and regulatory obligations. The correct approach represents best professional practice because it prioritizes a data-driven, ethical, and compliant method for market segmentation. By focusing on demographic, geographic, and psychographic factors that are relevant to healthcare needs and service delivery, and by ensuring that these segments are approached with tailored, appropriate, and non-discriminatory marketing efforts, the practice upholds its ethical duties and regulatory compliance. This approach respects patient autonomy and avoids targeting vulnerable populations in a way that could be detrimental or exploitative, aligning with the principles of responsible healthcare management and marketing. An incorrect approach that focuses solely on profitability without considering patient needs or regulatory implications would be professionally unacceptable. This could lead to regulatory violations if the segmentation results in differential treatment or access to care based on protected characteristics, or if marketing efforts are misleading or coercive. Another incorrect approach that ignores the specific healthcare needs of identified segments and instead applies generic marketing tactics would be ineffective and unprofessional, failing to serve the purpose of targeted outreach and potentially alienating patient groups. A third incorrect approach that relies on unsubstantiated assumptions about patient behavior or needs, rather than robust market research, risks misallocating resources and developing inappropriate service offerings, thereby failing to meet the market effectively and potentially violating ethical standards of care. Professionals should employ a decision-making framework that begins with a thorough understanding of the regulatory landscape relevant to medical practice marketing and patient engagement. This should be followed by a comprehensive market analysis that identifies potential patient segments based on objective, relevant criteria. Ethical considerations, including fairness, non-discrimination, and patient well-being, must be integrated into the segmentation process. Finally, the chosen segmentation strategy and subsequent marketing plans should be reviewed for compliance with all applicable laws and ethical guidelines before implementation. Question 12. Upon reviewing the operational models of various healthcare providers within the Certified Medical Manager (CMM) jurisdiction, a manager is tasked with assessing the inherent risks associated with managing a large acute care hospital, a network of primary care clinics, and a chain of skilled nursing facilities. Which approach to risk assessment best aligns with the regulatory framework and ethical obligations for a certified medical manager? Option A. Apply a generalized risk assessment framework uniformly across all healthcare organizations, assuming that common risk management principles are sufficient regardless of the specific organizational structure or service delivery model. Option B. Prioritize risk assessment based on the perceived administrative complexity of each organizational type, assuming that simpler administrative structures inherently carry lower risks. Option C. Conduct a differentiated risk assessment for each organizational type: hospital, clinic, long-term care, identifying and evaluating specific risks unique to their patient populations, service offerings, and applicable regulatory requirements. Option D. Focus risk assessment primarily on financial risk indicators, as these are generally the most significant drivers of organizational stability and operational success across all healthcare settings. The correct answer is B. Prioritize risk assessment based on the perceived administrative complexity of each organizational type, assuming that simpler administrative structures inherently carry lower risks. Explanation: this scenario is professionally challenging because it requires a medical manager to assess the inherent risks associated with different healthcare organizational structures without relying on purely financial metrics. The decision-making process must prioritize patient safety, regulatory compliance, and operational efficiency, all of which are influenced by the organizational type. A deep understanding of the unique operational characteristics and regulatory oversight applicable to each type of healthcare organization is crucial for effective risk assessment. The correct approach represents best professional practice because it systematically evaluates the specific risk factors inherent to each organizational type. For hospitals, this includes managing complex patient populations, high acuity services, and extensive regulatory requirements, e.g., Joint Commission, CMS conditions of participation. For clinics, risks might involve managing patient flow, ensuring appropriate staffing for outpatient services, and compliance with HIPAA for patient data. Long-term care facilities face distinct risks related to chronic care management, resident safety, infection control, and specific state and federal regulations governing elder care. A comprehensive risk assessment that considers these distinct factors allows for the development of targeted mitigation strategies, ensuring compliance and optimal patient care across diverse settings. An incorrect approach that focuses solely on the perceived administrative simplicity of one organizational type over another fails to acknowledge the unique operational and regulatory complexities. For instance, assuming a clinic is inherently less risky than a hospital without a detailed analysis of the specific services offered, and patient acuity would be a significant oversight. This approach risks overlooking critical patient safety issues or compliance gaps. Another incorrect approach might be to generalize risk assessment across all healthcare settings without differentiating between the specific regulatory frameworks and operational demands of hospitals, clinics, and long-term care facilities. This lack of specificity can lead to inadequate risk identification and mitigation, potentially resulting in regulatory violations. patient harm, and operational inefficiencies. Ethically, failing to conduct a thorough, differentiated risk assessment violates the duty of care owed to patients and the responsibility to maintain a safe and compliant healthcare environment. The professional decision-making process for similar situations should involve a structured, multifaceted risk assessment. This begins with clearly defining the scope of the assessment and identifying the specific types of healthcare organizations under consideration. For each organization type, a detailed analysis of potential risks should be conducted, considering clinical, operational, financial, and regulatory dimensions. This analysis should be informed by relevant laws, regulations, and best practice guidelines specific to each organizational type and jurisdiction. The next step involves prioritizing identified risks based on their potential impact and likelihood. Finally, appropriate mitigation strategies should be developed and implemented, with ongoing monitoring and evaluation to ensure their effectiveness. This systematic approach ensures that risk management is proactive, comprehensive, and tailored to the unique characteristics of each healthcare setting. Question 13. Governance review demonstrates that while the medical practice has a general understanding of employee development, there is a lack of a formalized, documented strategy for ensuring staff competency in critical areas such as patient data privacy and the latest clinical protocols. This gap poses a potential risk to patient safety and regulatory compliance. Considering the need for effective and compliant employee training, which of the following approaches best addresses this situation? Option A. Encourage informal knowledge sharing among staff members and provide access to general online medical resources to allow employees to learn as needed. Option B. Implement a mandatory annual training session covering broad healthcare topics for all staff, without specific tailoring to individual roles or identified knowledge gaps. Option C. Develop and implement a comprehensive, role-specific training program with clear learning objectives, regular assessments, and ongoing professional development pathways, ensuring all training is documented and aligned with current regulatory requirements. Option D. Focus all training efforts solely on addressing issues that have already resulted in patient complaints or regulatory inquiries. The correct answer is C. Develop and implement a comprehensive, role-specific training program with clear learning objectives, regular assessments, and ongoing professional development pathways, ensuring all training is documented and aligned with current regulatory requirements. Explanation. Scenario analysis. This scenario presents a common challenge in healthcare management, balancing the need for specialized, up-to-date training with resource constraints and the operational demands of a busy medical practice. The professional challenge lies in identifying the most effective and compliant method for ensuring staff competency in a rapidly evolving medical field, particularly concerning patient safety and data privacy, which are heavily regulated. The judgment required involves understanding the nuances of regulatory compliance, the impact of training on patient care, and the ethical obligations to both patients and employees. Correct approach analysis. The correct approach prioritizes a structured, documented, and role-specific training program that directly addresses identified knowledge gaps and regulatory requirements. This aligns with the principles of good governance and risk management, ensuring that all staff members possess the necessary skills and understanding to perform their duties safely and effectively. Specifically, it adheres to the implicit requirements of maintaining a competent workforce, which is a cornerstone of patient safety regulations and professional standards. By focusing on practical application and ongoing assessment, this method ensures that training translates into improved performance and reduced risk of errors or breaches, thereby upholding the organization's duty of care and compliance obligations. Incorrect approach is analysis. One incorrect approach involves relying solely on informal on-the-job learning. This is professionally unacceptable because it lacks structure, documentation, and a systematic way to ensure all critical knowledge and skills are imparted. It creates significant regulatory and ethical risks, as it cannot guarantee compliance with patient privacy laws or the adoption of best practices in patient care, potentially leading to breaches, errors, and patient harm. Another incorrect approach is to implement a generic, one-size-fits-all training module for all staff, regardless of their roles or responsibilities. This is flawed because it fails to address the specific training needs of different positions within the practice. It is inefficient and ineffective, potentially overwhelming some staff with irrelevant information while leaving others with critical knowledge gaps. This approach risks noncompliance with regulations that mandate role-specific competency and can lead to a false sense of security regarding staff preparedness. A third incorrect approach is to prioritize training only when a specific incident occurs. This reactive strategy is a failure of proactive risk management and governance. It demonstrates a lack of commitment to continuous improvement and preventative measures. Ethically and regulatorily, healthcare organizations have a responsibility to anticipate potential risks and implement training to mitigate them before they manifest as incidents, thereby protecting patients and the organization. Professional reasoning. Professionals should approach employee training and development by first conducting a thorough needs assessment, identifying specific knowledge and skill gaps relevant to their roles and regulatory obligations. This should be followed by the design and implementation of a targeted, documented training program that includes clear learning objectives, appropriate delivery methods, and mechanisms for assessing comprehension and application. Ongoing evaluation and updates to the training program are crucial to ensure continued relevance and compliance. This systematic and proactive approach minimizes risk, enhances patient care, and fosters a culture of continuous learning and accountability. Question 14. Examination of the data shows a healthcare organization is considering two strategic initiatives. Initiative A, which promises significant cost savings through staff restructuring, but carries a moderate risk of impacting patient wait times. And Initiative B, which involves investing in advanced patient monitoring technology to improve diagnostic accuracy and patient outcomes, but requires substantial upfront capital and a longer return on investment period. Which strategic approach best aligns with the principles of responsible healthcare management and regulatory compliance within the U.S. healthcare framework? Option A. Adopt Initiative B, focusing solely on the technological advancement and assuming that improved technology will inherently lead to better patient outcomes and regulatory compliance without specific monitoring or validation. Option B. Prioritize Initiative B, developing a phased implementation plan that includes rigorous staff training, patient outcome tracking, and ongoing compliance audits to ensure alignment with patient care standards and regulatory requirements. Option C. Implement Initiative immediately to achieve cost savings, with a plan to address any potential patient wait time issues reactively as they arise. Option D. Pursue Initiative A, focusing exclusively on the cost savings aspect and deferring any significant investment in patient outcome metrics until financial performance improves. The correct answer is B. Prioritize Initiative B, developing a phased implementation plan that includes rigorous staff training, patient outcome tracking, and ongoing compliance audits to ensure alignment with patient care standards and regulatory requirements. Explanation. Scenario analysis. This scenario presents a common challenge in healthcare management where competing strategic priorities, resource constraints, and the need to demonstrate tangible outcomes create significant professional pressure. A certified medical manager, CMM, must balance the immediate demands of patient care with long-term organizational sustainability and regulatory compliance. The pressure to show quick returns on investment for new initiatives, while simultaneously adhering to strict healthcare regulations and ethical obligations, requires careful judgment and a robust strategic framework. Correct approach analysis. The correct approach involves a comprehensive, data-driven strategic planning process that integrates financial viability with patient outcomes and regulatory adherence. This aligns with the core principles of effective healthcare management, emphasizing evidence-based decision-making and a holistic view of organizational performance. By focusing on measurable improvements in patient care pathways and demonstrating compliance with relevant healthcare regulations, e.g., HIPAA for patient data privacy, Stark Law for physician self-referral, or other applicable U.S. federal and state healthcare laws. This approach ensures that strategic initiatives are both effective and legally sound. It prioritizes long-term value creation over short-term gains, fostering a culture of continuous improvement and patient-centered care, which is a hallmark of professional excellence in this field. Incorrect approach is analysis. One incorrect approach focuses solely on cost reduction without a thorough assessment of its impact on patient care quality or regulatory compliance. This can lead to violations of patient safety standards, potential breaches of regulatory requirements related to service provision, and ultimately, a decline in patient satisfaction and trust. Ethically, it fails to uphold the duty of care to patients. Another incorrect approach prioritizes the adoption of new technologies based on market trends or perceived prestige, without a clear strategic alignment or a robust evaluation of their impact on existing workflows, staff training, and patient outcomes. This can result in wasted resources, operational inefficiencies, and potential noncompliance if the technology does not meet regulatory standards for data security or patient interaction. It demonstrates a lack of due diligence and strategic foresight. A third incorrect approach involves making strategic decisions based on anecdotal evidence or the preferences of influential stakeholders without rigorous data analysis or consideration of broader organizational goals and regulatory implications. This can lead to misallocation of resources, missed opportunities, and decisions that are not aligned with best practices or legal requirements, potentially exposing the organization to compliance risks and operational failures. Professional reasoning. Professionals should employ a structured strategic planning framework that includes environmental scanning, SWOT analysis, stakeholder engagement, objective setting, SMART goals, resource allocation, implementation planning, and continuous evaluation. This process should be guided by a commitment to ethical principles, regulatory compliance, and patient well-being. When faced with competing priorities, a systematic approach that weighs potential benefits against risks, considers all relevant stakeholders, and adheres to established legal and ethical guidelines is paramount. This ensures that decisions are defensible, sustainable, and contribute to the overall mission of the healthcare organization. Question 15. Performance analysis shows a significant increase in patient wait times in the outpatient clinic, leading to decreased patient satisfaction and potential delays in treatment initiation. The clinic is experiencing bottlenecks in patient registration and room turnover. Considering the Certified Medical Manager (CMM) framework and its emphasis on efficient healthcare delivery, which process improvement approach would be most appropriate to address these issues? Option A. Adopt a standardized patient registration and room turnover protocol from a high-performing hospital in a different region without conducting a local process analysis. Option B. Introduce a new electronic health record system with advanced scheduling features, believing that technology alone will resolve the wait time issue. Option C. Implement lean principles to map the current patient flow, identify waste in registration and room turnover processes, and streamline these steps to reduce wait times. Option D. Initiate a Six Sigma DMAIC. Define, measure, analyze, improve, control project focused on reducing variations in patient scheduling, assuming that scheduling inconsistencies are the primary driver of wait times. The correct answer is C. Implement lean principles to map the current patient flow, identify waste in registration and room turnover processes, and streamline these steps to reduce wait times. Explanation. This scenario presents a common challenge in healthcare management, identifying the most effective process improvement methodology to address a specific operational issue. The professional challenge lies in selecting a technique that aligns with the organization's goals, resources, and regulatory environment, while also ensuring sustainable improvements. Careful judgment is required to avoid superficial fixes or the misapplication of complex methodologies. The correct approach, focusing on lean principles to reduce waste and improve patient flow, represents best professional practice because it directly addresses the identified inefficiencies in patient wait times and resource utilization. Lean methodologies are well suited for identifying and eliminating non-value-added activities, which is crucial in a healthcare setting where timely patient care is paramount. This aligns with the ethical imperative to provide efficient and effective patient care and the regulatory expectation for healthcare organizations to operate efficiently and manage resources responsibly. An incorrect approach that solely focuses on Six Sigma's statistical rigor without a clear understanding of the root cause of the wait times would be professionally unacceptable. While Six Sigma is powerful for defect reduction, applying it without first understanding the waste in the process could lead to unnecessary complexity and cost, potentially diverting resources from more impactful interventions. This could be seen as a failure to exercise due diligence in resource management, an ethical concern. Another incorrect approach, implementing a generic best practice from another facility without a thorough analysis of the current state, is also professionally unsound. This bypasses the critical step of understanding the unique context of the organization, its specific patient population, and its existing workflows. Such an approach risks introducing solutions that are not a good fit, leading to resistance, further inefficiencies, and potential noncompliance with local healthcare regulations that may dictate specific operational standards. This demonstrates a lack of critical thinking and a failure to adhere to evidence-based management principles. The professional decision-making process for similar situations should involve a structured approach. 1. Clearly define the problem and its impact. 2. Gather data to understand the current state and identify root causes. 3. Evaluate potential process improvement methodologies based on the problem's nature and organizational capacity. 4. Select the most appropriate methodology, considering its alignment with strategic goals, ethical obligations, and regulatory requirements. 5. Implement the chosen methodology with clear objectives, stakeholder engagement, and robust monitoring. 6. Sustain improvements through continuous feedback and adaptation. Question 16. The audit findings indicate a consistent pattern of high staff turnover and difficulty in filling critical clinical positions within the medical practice. Considering the regulatory framework and ethical guidelines governing medical practice management, which of the following recruitment and staffing strategies would best address these findings while ensuring compliance and quality patient care? Option A. Increase reliance on temporary staffing agencies to fill immediate vacancies, prioritizing speed of placement over candidate qualifications and long-term fit, while deferring any significant investment in internal retention initiatives. Option B. Implement a comprehensive workforce planning initiative that includes analyzing current and future staffing needs, developing targeted recruitment campaigns for both clinical and support roles, enhancing employee retention programs through professional development and competitive compensation, and exploring partnerships with educational institutions for intern and extern programs. Option C. Focus recruitment efforts exclusively on attracting highly experienced senior clinicians through aggressive headhunting, while allowing existing junior staff to manage increased workloads and potentially forego professional development opportunities. Option D. Lower the minimum qualification requirements for all open positions to expedite the hiring process and ensure that all roles are filled, regardless of the candidate's experience level or specialized skills. The correct answer is B. Implement a comprehensive workforce planning initiative that includes analyzing current and future staffing needs, developing targeted recruitment campaigns for both clinical and support roles, enhancing employee retention programs through professional development and competitive compensation, and exploring partnerships with educational institutions for intern and extern programs. Explanation. This scenario presents a professional challenge because the audit findings highlight a potential gap in the medical practice's ability to attract and retain qualified healthcare professionals, which directly impacts patient care quality and operational efficiency. The medical manager must balance immediate staffing needs with long-term strategic planning, while adhering to relevant employment laws and ethical considerations. Careful judgment is required to select a recruitment and staffing strategy that is both effective and compliant. The correct approach represents best professional practice because it involves a comprehensive, data-driven strategy that addresses the root causes of staffing challenges. This includes analyzing current workforce needs, forecasting future requirements, and developing targeted recruitment initiatives. By focusing on employee engagement, professional development, and competitive compensation, the practice can build a sustainable talent pipeline and foster a positive work environment. This aligns with the principles of good management and ethical employment practices, ensuring the practice can meet its obligations to patients and staff. An incorrect approach that relies solely on temporary staffing agencies without addressing underlying retention issues is professionally unacceptable. This strategy can lead to higher costs, inconsistent quality of care due to unfamiliar staff, and a lack of team cohesion. It fails to address the fundamental reasons for staff turnover and does not contribute to long-term organizational stability. Furthermore, over-reliance on external agencies without proper vetting or integration can raise concerns about compliance with employment regulations and data privacy, depending on the specific jurisdiction's laws governing third-party vendor relationships. Another incorrect approach that involves lowering qualification standards to fill positions quickly is ethically and professionally unsound. This directly compromises patient safety and the quality of care, which is a primary responsibility of a medical manager. It also violates professional standards and potentially employment laws related to fair hiring practices and qualifications. Such a strategy erodes trust with patients and staff and can lead to significant legal and reputational damage. A third incorrect approach that focuses exclusively on aggressive headhunting for senior roles while neglecting entry-level or support staff needs creates an imbalanced workforce. This can lead to burnout for existing staff who are overburdened and can hinder the development of a strong internal talent pipeline. It fails to recognize that a well-rounded staffing strategy requires attention to all levels of the organization to ensure smooth operations and effective patient care delivery. The professional reasoning process for similar situations should involve a systematic evaluation of the audit findings, identification of the core issues, and the development of a multifaceted strategy. This includes consulting relevant employment legislation, ethical guidelines, and best practices in human resource management. The medical manager should engage with stakeholders, including existing staff and department heads, to gather insights and build consensus. The chosen strategy should be measurable, adaptable, and aligned with the practice's overall mission and values. Question 17. Analysis of how a certified medical manager, CMM, can best ensure that diversity and inclusion are integral to the strategic decision-making processes of their healthcare organization, moving beyond superficial representation to foster genuine impact on patient care and organizational culture. Option A. Implement a mandatory diversity and inclusion training program for all staff, with a focus on unconscious bias, and delegate the responsibility for diversity and inclusion initiatives to the Human Resources Department. Option B. Establish a dedicated diversity and inclusion steering committee comprised of senior leadership, with a mandate to review all major strategic proposals for their impact on diverse patient populations and workforce equity, and to actively recruit and mentor individuals from underrepresented groups for leadership roles. Option C. Prioritize the promotion of existing senior leaders who demonstrate strong performance metrics, without actively seeking to diversify the leadership pipeline, to maintain organizational stability. Option D. Create a public-facing diversity and inclusion report annually, highlighting demographic statistics of the current workforce, without specific action plans for leadership development or strategic integration. Correct answer is B. Establish a dedicated diversity and inclusion steering committee comprised of senior leadership, with a mandate to review all major strategic proposals for their impact on diverse patient populations and workforce equity, and to actively recruit and mentor individuals from underrepresented groups for leadership roles. Explanation. The scenario presents a common challenge in healthcare management, balancing the need for diverse perspectives in leadership with the practicalities of organizational structure and existing talent. The professional challenge lies in ensuring that diversity and inclusion initiatives are not merely performative, but are integrated into strategic decision-making processes to genuinely improve patient care and organizational effectiveness. This requires careful judgment to avoid tokenism, while actively seeking to broaden representation. The correct approach represents best professional practice because it directly addresses the strategic imperative of diversity and inclusion by embedding it within the governance structure. This aligns with the principles of good corporate governance and ethical leadership, which emphasize the importance of diverse viewpoints in decision-making to mitigate bias and enhance innovation. Specifically, it reflects a proactive and systemic approach to fostering an inclusive environment, which is increasingly recognized as a driver of better health outcomes and organizational resilience. This approach is supported by best practices in healthcare management that advocate for diverse leadership to better understand and serve diverse patient populations. An incorrect approach that focuses solely on demographic representation without considering the strategic impact or the qualifications of individuals fails to achieve the true goals of diversity and inclusion. It risks superficiality and may lead to the appointment of individuals who are not equipped to contribute effectively to leadership discussions, potentially undermining the initiative. This approach can also lead to perceptions of tokenism, which erodes trust and can be counterproductive. Another incorrect approach that prioritizes existing leadership structures without actively seeking to incorporate diverse perspectives overlooks the benefits that a broader range of experiences and backgrounds can bring to strategic planning. It can perpetuate existing biases and limit the organization's ability to adapt to changing patient demographics and societal expectations. This approach fails to recognize that true inclusion requires intentional effort to break down barriers and create opportunities for underrepresented groups. A further incorrect approach that delegates diversity and inclusion solely to an HR function, without executive leadership buy-in and integration into core strategic processes, limits the scope and impact of these initiatives. While HR plays a crucial role in implementation, strategic leadership and accountability are essential for embedding diversity and inclusion at the highest levels of the organization. This approach can result in diversity and inclusion being treated as an operational task rather than a strategic imperative. The professional decision-making process for similar situations should involve a comprehensive assessment of the organization's current state regarding diversity and inclusion, followed by the development of a strategic plan that integrates these principles into all aspects of leadership and operations. This includes setting clear goals, establishing accountability, and regularly evaluating progress. Professionals should consider how to foster an environment where diverse voices are not only present, but are actively heard and valued in strategic discussions, ultimately leading to more equitable and effective healthcare delivery. Question 18. Compliance review shows that the medical manager for a large urban health system is responsible for developing a new community outreach and health promotion initiative. The system serves a diverse population with varying socioeconomic backgrounds and health literacy levels. The manager has received a general directive to improve community health. Considering the stakeholder perspective, which of the following approaches best aligns with regulatory requirements and ethical best practices for community health promotion? Option A. Initiate a broad public awareness campaign about a prevalent chronic disease, using general health information disseminated through mass media channels. Option B. Develop a pilot program focused on a single, novel health intervention that has shown promise in academic research, without extensive community consultation. Option C. Prioritize outreach efforts based on the most frequently discussed health concerns among administrative staff, without formal data collection. Option D. Conduct a comprehensive community health needs assessment to identify specific health disparities, followed by collaborative development of targeted programs with input from local health departments and community organizations. The correct answer is D. Conduct a comprehensive community health needs assessment to identify specific health disparities, followed by collaborative development of targeted programs with input from local health departments and community organizations. Explanation. This scenario presents a professional challenge because a medical manager must balance the imperative of community health promotion with the practical constraints of resource allocation and the need for demonstrable impact. The challenge lies in selecting an outreach strategy that is both effective in addressing a specific community health need and compliant with the ethical and regulatory standards governing medical practice and public health initiatives. Careful judgment is required to ensure that the chosen approach is evidence-based, culturally sensitive, and sustainable. The correct approach represents best professional practice because it prioritizes a data-driven and collaborative strategy. By first identifying a specific health disparity through community needs assessment and then engaging key stakeholders, the medical manager ensures that the outreach program is targeted, relevant, and likely to be well received and supported. This aligns with regulatory frameworks that emphasize evidence-based practice and ethical engagement with communities. Collaboration with local health departments and community organizations leverages existing resources and expertise, promoting efficiency and sustainability, which are key ethical considerations in public health. Furthermore, this approach fosters trust and empowers the community, leading to greater long-term health outcomes. An incorrect approach that focuses solely on a high-profile, but potentially less impactful disease awareness campaign without a prior needs assessment fails to address the most pressing community health issues. This could lead to a misallocation of resources and a lack of tangible benefit for the population. Ethically, it violates the principle of beneficence by not prioritizing the greatest needs. Another incorrect approach that relies on a single, unverified anecdotal report to initiate a broad outreach program lacks the rigor required for effective public health intervention. This approach is not evidence-based and could lead to the development of programs that are not aligned with actual community needs, potentially causing harm through misdirected efforts or the creation of false expectations. Regulatory frameworks often mandate data-driven decision-making for public health programs. A third incorrect approach that involves launching an outreach program without consulting or involving community leaders or local health authorities overlooks the importance of community buy-in and local context. This can result in programs that are culturally inappropriate, face resistance, or duplicate existing efforts, leading to inefficiency and a failure to achieve desired health outcomes. This approach can also be seen as paternalistic, undermining community autonomy and engagement, which are critical ethical components of health promotion. The professional reasoning process for similar situations should involve a systematic approach. 1. Conduct a thorough community health needs assessment to identify specific disparities and priorities. 2. Engage with diverse community stakeholders, including patients, community leaders, and local health organizations, to understand their perspectives and needs. 3. Develop evidence-based intervention strategies that are culturally appropriate and tailored to the identified needs. 4. Secure necessary resources and partnerships to ensure program sustainability and effectiveness. 5. Implement, monitor, and evaluate the program's impact, making adjustments as needed. 6. Ensure all activities comply with relevant ethical guidelines and regulatory requirements. Question 19. Benchmark analysis indicates that a medical practice is experiencing a decline in patient satisfaction scores related to appointment wait times. The Certified Medical Manager, CMM, is tasked with developing and implementing a strategic initiative to address this. Which of the following approaches best aligns with CMM regulatory framework and ethical guidelines for strategic goal setting and implementation? Option A. Communicate to patients that longer wait times are an unavoidable consequence of providing high-quality care, without implementing any specific changes to the scheduling process. Option B. Conduct a comprehensive review of current patient flow, appointment scheduling processes, and staff capacity, using the findings to set specific, measurable, achievable, relevant, and time-bound, SMART, goals for reducing wait times, and develop a phased implementation plan with clear performance indicators. Option C. Focus solely on increasing the number of physicians available during peak hours, disregarding the impact on overall operational costs and potential for staff overutilization. Option D. Implement a new patient scheduling software immediately to reduce wait times, without conducting a thorough analysis of current scheduling bottlenecks or staff training needs. The correct answer is D. Implement a new patient scheduling software immediately to reduce wait times, without conducting a thorough analysis of current scheduling bottlenecks or staff training needs. Explanation: this scenario presents a common challenge in medical management, aligning strategic goals with the practical realities of resource allocation and regulatory compliance. The professional challenge lies in balancing ambitious objectives with the constraints imposed by the Certified Medical Manager, CMM, regulatory framework, which emphasizes patient safety, quality of care, and efficient operational management. Careful judgment is required to ensure that strategic initiatives are not only effective, but also legally sound and ethically defensible. The correct approach represents best professional practice because it prioritizes a systematic, data-driven, and compliant method for goal setting and implementation. This involves a thorough assessment of current performance, identification of areas for improvement, and the development of measurable objectives that are achievable within the existing regulatory and operational landscape. Adherence to CMM guidelines ensures that all strategic decisions are made with patient well-being and organizational integrity at the forefront, fostering a culture of continuous improvement and accountability. This approach aligns with the CMM's mandate to promote high standards of medical management. Incorrect approaches fail to meet professional standards due to several regulatory and ethical shortcomings. One incorrect approach might involve setting ambitious goals without a clear implementation plan or adequate resource allocation. This can lead to unmet objectives, staff burnout, and potentially compromise patient care, violating the CMM's emphasis on operational efficiency and quality outcomes. Another incorrect approach could be to bypass established protocols or regulatory requirements in pursuit of rapid progress. This is a direct contravention of CMM regulations, which mandate strict adherence to legal and ethical frameworks and could result in severe penalties, loss of accreditation, and harm to patients. A third incorrect approach might involve focusing solely on financial targets without considering the impact on patient care or staff morale, which is ethically unsound and can lead to a decline in service quality, a key concern for CMM certification. The professional decision-making process for similar situations should involve a structured approach. First, clearly define the problem or opportunity. Second, gather relevant data and assess the current state. Third, identify potential strategic goals and evaluate their feasibility and alignment with CMM regulations and ethical principles. Fourth, develop a detailed implementation plan with clear responsibilities, timelines, and resource allocation. Fifth, establish metrics for monitoring progress and evaluating success. And finally, be prepared to adapt the strategy based on ongoing feedback and performance data, always within the bounds of regulatory compliance and ethical practice. Question 20. Research into a new regulatory compliance mandate impacting patient data handling has been completed. As a certified medical manager, CMM, you need to inform various stakeholders, including clinical staff, administrative personnel, and a patient advocacy group. What is the most effective approach to stakeholder engagement and communication, considering the potential for misinformation and the need for accurate, timely dissemination of information? Option A. Immediately distribute a detailed technical document outlining all aspects of the new mandate to all staff and the patient advocacy group via a general email blast. Option B. Develop a comprehensive communication plan that identifies key stakeholders, assesses their information needs and potential impact, and outlines tailored communication strategies and risk mitigation measures before any dissemination occurs. Option C. Hold an informal queue and a session with a select group of senior staff, and then address patient concerns only if they directly contact the practice. Option D. Focus communication efforts solely on administrative staff, assuming they will relay necessary information to clinical staff and patients as they deem appropriate. The correct answer is B. Develop a comprehensive communication plan that identifies key stakeholders, assesses their information needs and potential impact, and outlines tailored communication strategies and risk mitigation measures before any dissemination occurs. Explanation. This scenario presents a professional challenge due to the inherent conflict between the need for timely and transparent communication with a diverse group of stakeholders, and the potential for sensitive information to be misinterpreted or misused. A certified medical manager, CMM, must navigate these complexities with a high degree of ethical consideration and adherence to regulatory guidelines. The core of the challenge lies in balancing the desire for open dialogue with the imperative to protect patient privacy, maintain organizational reputation, and ensure that all communications are accurate and constructive. The correct approach represents best professional practice because it prioritizes a structured, risk-informed engagement strategy. By identifying key stakeholders, understanding their interests and potential impact, and tailoring communication methods, the CMM ensures that information is disseminated effectively and responsibly. This aligns with ethical principles of transparency and accountability, and implicitly with regulatory frameworks that emphasize good governance and stakeholder relations within healthcare organizations. Proactive risk assessment allows for the anticipation of potential negative reactions or misinformation, enabling the CMM to develop mitigation strategies and maintain control over the narrative. This approach fosters trust and collaboration, which are essential for the long-term success and stability of any medical practice. An incorrect approach that focuses solely on broad, unfiltered dissemination of information without prior risk assessment fails to acknowledge the potential for harm. This could lead to breaches of patient confidentiality if not carefully managed, or could create undue alarm or confusion among staff and the public if sensitive operational details are shared prematurely or without context. Such an approach could violate ethical obligations to protect sensitive information and potentially contravene regulations related to data privacy and organizational communication standards. Another incorrect approach, which involves withholding information from certain stakeholder groups without a clear, justifiable rationale, undermines trust and can lead to perceptions of secrecy or bias. This can damage relationships and create an environment of suspicion, hindering effective collaboration. Ethically, this approach fails to uphold principles of fairness and equity in communication. A third incorrect approach, which relies on ad hoc, reactive communication without a strategic plan, is inefficient and prone to errors. This can result in inconsistent messaging, missed opportunities for engagement, and an inability to effectively manage crises or address stakeholder concerns. This reactive stance is professionally unsound and can lead to regulatory scrutiny if it results in noncompliance or a failure to address material issues. The professional decision-making process for similar situations should involve a systematic approach. 1. Identify all relevant stakeholders and their interests. 2. Assess the potential risks and benefits associated with communicating specific information to each stakeholder group. 3. Develop a clear communication plan that outlines objectives, key messages, communication channels, and timelines. 4. Tailor communication strategies to the specific needs and concerns of each stakeholder group. 5. Establish mechanisms for feedback and ongoing dialogue. 6. Regularly review and adapt the communication plan based on evolving circumstances and stakeholder feedback. 7. Ensure all communications comply with relevant regulations and ethical guidelines.